Hello all, welcome to my YouTube channel. Please watch my previous videos so that you get connection to this video. In this video, we will be discussing about behavioral therapy alone, not combined with cognitive therapy. So, behavioral therapy is a type of psychotherapy that focuses more on reducing unwanted or undesirable behavior and increasing a positive behavior in the client. And keeping this in our mind, let's see what Pavlov's classical conditioning is and how it is related to behaviorism. So, in this experiment, he exposed a dog to a bell. The dog did not respond to it. In the second step, he exposed it to food, and the dog obviously started salivating. He then started pairing the food and the bell together, which made the dog salivate for both of these things. And after several pairings like this, finally he exposed the dog to the bell, and the dog automatically started salivating when the bell was shown. Another example is say a child is taught A for apple continuously. So due to continuous learning that occurs in the child, the next time you ask the child what is A for, it would automatically say A for is apple, other than saying some other words. And another experiment or type of conditioning after this was operant conditioning. Operant conditioning is based on rewards and punishments, which are used to increase desirable behavior and decrease undesirable behavior respectively. Say a child is continuously being late to the class, which is undesirable behavior and that has to be changed. So we can change it into a positive behavior by giving a reward. So reward can be appreciation from the teacher whenever the student comes early, or ask the class to give him applaud whenever he is on time to the class. So all these rewards make the person develop or to continue the desirable behavior that he is learning. The other way is to give punishments. So when the child is late, punishing them or making them stand outside, not letting them attend the class or not giving them attendance. All this might to some extent be successful, but sometimes there are chances that the person might rebel back, or the punishments may not work and the undesirable behavior remains off in the person permanently. So the acceptance of rewards or punishment depends from or varies from person to person, because all of them might not like the same reward or punishment. So first one has to figure out what might change their behavior, and then choose the particular or corresponding reward or punishment for them. And now let's see some of the techniques that are used in behavioral therapy, and this is so many, but we would be discussing a very few among these. So first one is systematic desensitization. So here the process happens systematically. First the client is taught some relaxation techniques like breathing, meditation and all of that, and slowly the client is exposed to the fear. Whatever the client has fear on, they are exposed to that fear slowly. Gradually it happens, not spontaneously, and then the client's behavior or the perception towards that stimuli is changed. And in flooding, something similar to systematic desensitization occurs. In this, the client is rapidly exposed to the fear or the phobia that they have. Say for an example, a client is scared of spiders, so they are exposed to a spider rapidly by locking them or not letting them run away. Slowly the client realizes that there is no harm for them, and then they start getting normalizing. Ethical issues are second priorities here. And in aversion, the aversion thought or behavior of the client is paired with unwanted stimulus. Like if a person's smoking habit has to be changed, it is first paired with unwanted in the sense like tablets that causes headache or vomiting or something like that. When it is continuously paired, the client would definitely, or the person who is an alcoholic would definitely reduce in their alcohol consumption because of the fear that they might vomit or feel nausea again. Extinction is again used to remove undesirable behavior by not providing attention or reward to that particular behavior, so that the person would automatically cut on the negative behavior that they are showing. Modeling is where the therapist himself or herself voluntarily models on how the client is supposed to behave in particular situations, or there are also volunteers who would enact for the client in order to show them how to behave in certain situations. Token economies is something similar to rewards. If a person's say, let's take a child's example. If a child's behavior, some good behavior has to be continued or increased, the child is given tokens. If they perform good in their exams, they are given more tokens. In case they do not show right behavior in their school space, the tokens are withdrawn. So this is a simple example and brief explanation about token economies and also other type of techniques. And now let's see the advantages and disadvantages of behavioral therapy. It has been proven to help both adults and children change their behaviors. It helps develop more rational thought process, and it also develops self-esteem in the person, and also it benefits by treating addiction, anxiety disorders, bipolar, low self-esteem of the person, schizophrenia, suicidal ideation and depression. And major disadvantage in this would be the lack of skills in the therapist and also disinterest of the client towards this therapy. Less involvement and commitment of the client might lead to failure of this therapy. Research say that 67% of people who have underwent this therapy have experienced a positive change in their lives, and it has been proved that behavioral therapy is also one of the effective methods used in psychotherapy. This is all about the video. Please like, share, comment and subscribe to this channel if you are interested about psychology and to know more about psychology. Thank you.